On the full circle, the late great South African legend coming through with African Sunset in the second hour of the show. And this one taken from the album Welela, which is a beautiful body of work by Miriam Makeba. I think it came out in 1990, somewhere around there. And of course, as you know, today is the day that she passed on back in 2008 in Italy, coming out of a performance. She was on stage literally until the day she passed on, having left her mark both as a musician as well as a political and equality activist in Africa and worldwide. Her story is absolutely incredible, and the amount of lives that she's inspired and touched since then, from the likes of Thandiswa Mazwai to the likes of Simpiwe Dana and Somi, and so the list of musicians goes on, who've really made it part of their life's work to keep her memory alive through the type of music that they produce, as well as just carrying on the baton of being vocal, musical activists, people that I call artists who are activists in their respective corners. Right now, though, as we get into the second hour of the show, we are going to be shifting gears a little bit and looking at a collaboration between the University of Cape Town and Kwanele app. And they are collaborating in an effort to fight GBV. And joining me on the line, we've got Anne Isaac, who's the legal manager of UCT's Special Tribunal, and they deal with formal disciplinary processes for sexual misconduct, as well as Lenora Tima, who's the founder of Kwanele. And like I said, the University of Cape Town has collaborated with Kwanele to introduce the Kwanele app to students across its campuses. Perhaps maybe let me start with you, Anne. Good afternoon. How are you?
Hi there. I'm
Hi.
well. Thank you so much for having me on
It,
your station today.
it's only but a pleasure. Maybe let's start with, what necessitated the university to be proactive in this matter and seek to partner up with Kwanele.
So the university, as you know, has several forums for disciplinary processes for staff and for students. In 2019, under the then DVC Professor Ferris, in 2019, we started a project where we created a specialized tribunal, which is a university court
Mm,
that deals only with sexual misconduct cases on campus for both staff and students.
mm,
So it was quite an innovation in synergizing a formal process for formal cases around sexual misconduct. A lot of work had to go in terms of ensuring that we were compliant with the necessary legislations around employee-employer relations, labor law, etc. But we finally did synergize a process, and so we have a university corp that deals with the formal reports that come through.
mm,
And in this work, I don't believe we can do any of this work in countering gender-based violence in silos. I think it's absolutely critical to collaborate, to partner, and to work together with many different stakeholders in coming up with effective outcomes for
mm,
survivors of gender-based violence. So at the university, we have our own reporting system, which is an online reporting system that sits in the Office of Inclusivity and Change.
mm,
And that online reporting system allows students and staff to
mm,
report cases online where they would give their information either anonymously or giving details. And the OIC will then follow up by the survivor specialist and talk survivors through complainants, survivors through the process, and whether they wish to do, resolve the matter informally or through a formal process. And
mm,
once it is sent to us for a formal process, what basically happens for me is that we've got to investigate, we've got to consult and prepare a case to present before a panel of a chairperson
Mm.
sitting with a staff and a student assessor and present evidence for the complainant to come to a verdict as to whether, the perpetrator is guilty of this or not.
Mm.
One of the challenges, and the interesting thing is every time you take 10 steps forward in these processes and meeting the objectives of, our advocacy around sexual and gender-based violence, you'll always have challenges that come up.
Mm.
And one of the aspects that we've always, I think it's a global challenge, is in how we collect evidence. Usually with sexual and gender-based violence, you're not going to have many witnesses to the actual offense.
Yeah.
And so when someone comes to give their evidence, we want to avoid, in a survivor-centered process, we want to avoid the person experiencing re-victimization.
Yeah.
But sometimes when a person who has experienced trauma does in fact relay the experience because of the the neurobiological aspects of trauma. I'm not an expert on it, but we've done enough research and we've done presentations and how difficult it is for that evidence to come through in a chronological manner, for example, and can often be attacked by the attorney representing a perpetrator or we call them respondents in our tribunals. And so it can be a very difficult process for a survivor to go through. And so when I attended one of Kwanele's presentations outside of UCT, I was very impressed by the functions that this app actually has. Now, it has various apps that Leonora will obviously talk you through. But I think very significant for me as the legal manager for a tribunal that has to take evidence through a system, the benefit is that the app has a function that can actually record an experience that's happening in real time. And this experience can then be stored in a vault on the app. And this is so incredibly exciting for me because, if more people are using it, whether it's students, staff, the general public, and we've got evidence that can be stored in this way, it can be used to corroborate and to help a survivor go through, whether it's through a university disciplinary or through the criminal justice system where evidence has to be presented. I think the benefits of the app is really critical to the work that we do, and therefore the collaboration with Kwanele and the team is very significant for UCT.
Yeah. Leonora, let's jump you in here, a founder of Kwanele Foundation. And I do want to understand in terms of how the app works, as Anne has just alluded to that sort of real-time recording, but also for Kwanele Foundation, working with the campus for you, what was the attraction in lending I guess your platform and your system to support the endeavors that they were doing and putting into place?
Hi, good afternoon, and thank you so much for having me. Just a clarity point before we start. So we are actually not the Kwanele Foundation. We are Kwanele Bringing Women Justice. The Kwanele Foundation is based out of Joburg.
Okay.
Just for clarity around that.
Thank you.
So yeah, it's interesting how we came to that. So we originally we've been building this tech for about 18 months now. It's been live since November of last year. We've been quite cautious in our onboarding and our testing, just because obviously sometimes it's life and death situations we deal with. So being intentional about making sure that it really did serve the right purpose, that it was easy to use, all of those kind of things. And then we found that when we were going into very grassroots communities, like in the rural Eastern Cape, for example, or even in Nyanga or Khayelitsha, the tech literacy is still quite bad, and digital rights awareness and all of those kind of things. And so we found that there was quite a big resistance potentially to some of the tech that we were introducing, because people are not yet familiar with using applications in these ways in certain demographic groups. And so for us, students were the perfect people to use our tech to start with, because a lot of them come from Nyanga, Kailicha, like Ocean View communities that are inundated with violence and gender-based violence, but they are tech savvy. So they are used to using technology in this way. And so that's why when I met Anne at our event, I was so excited because I'd been trying to like penetrate the university space and she was super keen for this collaboration. So it was like a win-win situation.
Mm-mm. Talk us through some of the features, that are sort of in the app or incorporated in the app that come in handy, particularly as you both said, in recording instances of GBV and further then helping the collection of evidence.
100%. So the app, it has a panic button, which we have an integration with Armed Response. And it's also data free and free. So it sits on a data free platform where we reverse bill if somebody doesn't have any data available. We then cover those costs. So if you are in an emergency situation, for example, you activate the panic button, and then an armed response team will reach out to you and they will then dispatch using your location. And if they do not have coverage in your area, they will ensure that SAPs are dispatched to where you are. And then the second that you activate the panic button, it live and audio streams for about 2 minutes, which is then geolocated and timestamped and stored in the cloud so that it's then court admissible, which is what Anne was referring to. And then you can also select that it would notify a friend of your location, but that's something you can choose whether you have that or not. And then the other thing that we have currently built in the Air app is a database of services, which looks at your location and tells you what services are available to you, like the Tutuzela care centers or rape crisis or whatever services you might be looking to access. And then it also has a hidden vault, which is in the hamburger menu, and you open it and it's passworded. And then in the vault, you can either choose your case or your story. If you click on your case, then you can populate specific information pertaining to a case that you have open. And then it might ask you questions like your prosecutor's name, your investigating officer, all of those kind of things. And the reason we put that in there is that we found that quite a lot of survivors were coming to us who were struggling within the criminal justice system, because their docket had been misplaced, or perhaps the prosecution had decided not to prosecute, but they didn't fully understand why. We find often there's a disconnect between the language used in the criminal justice system and the language on the ground, where often communication gets lost. So we help survivors track what happened to their case and then work with the prosecutors or the investigating officers to try and bridge that communication gap. And then the other side of the vault is My Story, which is where you can upload audiovisual or narrative data, again, that's timestamped, geolocated. So say, for example, you're in a domestic violence situation and you're not yet ready to open a criminal case, but you want to start collecting data, or you had an incident and you know your perpetrator and you also want to collect data, but you're not ready yet to report it, then you have a place where you can store it, and we keep it for 10 years. Because then we have the opposite, where we have people then reach out to us who said, something happened 3 years ago, but I don't have any evidence. Can you help me? Like, I want them to be arrested. And then it becomes very challenging to prosecute cases like that. So that's what we have currently. And then what we're going live now with 16 days for is we're building a chatbot that uses generative AI, that is then going to be built into the app, but it's also going to be in Facebook and WhatsApp, where it uses AI to guide survivors through the criminal justice system. So you can go on and you can talk to our chatbot, who's called Zuzi, and you can ask her questions like, I need a protection order or help, or how do I get counseling, or whatever it is. And we're training her to use very simple language to then guide survivors through the systems.
Yeah, definitely lots for us to explore, and it sounds like quite a useful tool, not just in campus, but also for society broadly. Ladies, I think let's take a quick break here, and then we'll come back on the other side of this. And I want to ask Anne, in terms of the data that's collected through the app, how has that sort of come in handy at UCT, particularly with the interventions that the varsity has put into place? But for now, though, let's go into a break. It is the Full Circle on SAFM leading the conversation, and I know that Dineo Mutawung is standing by to bring you those headline news in just a matter of moments. It is the Full Circle with myself, Bridget Masinga. We are still in conversation with Anne Isaac, who's the legal manager at UCT's Special Tribunal, and Lenora Timo is the founder of Gwanele. And the two institutions have collaborated to fight the scourge of GBV. And of course, testing out this partnership at the UCT campus. And now that we understand how the Gwanele app works and some of the features that it has, and really it just sounds like an incredible resource. I then wonder, and in terms of the varsity, does the data that's collected through the app, has that come in handy in addressing the GBV trends on campus? And perhaps one step further, have you been able to then put into place certain interventions based on what you are getting from the information that's being shared, or that's being given to you from those who use the Gwanele app?
Thank you. You've hit the nail on the head. We actually haven't introduced the app. That's going to happen in the next few weeks. We did we hosted an event, as you know, and we introduced what the app does through Cornelia, and Leonora's team was there. and we will be rolling this out. So currently, we haven't started collecting any data from Cornell, but that is the intention. But just to clarify, UCT has an online reporting system already through the Office of Inclusivity and Change. So that's an online reporting tool that does in fact collect data and geographical, data in terms of common occurrences, for example, which are the residences, student residences that are showing a higher number of, case reports. It doesn't necessarily mean, it's happening more there. It means we're getting, a significant number of cases from a particular residence or a particular area within the campus community, as well as off campus. So that's already in place in terms of reporting internally. What the Cornell app is going to do for us as a campus community with the additional support on this data is if we start getting the data as envisioned, and it creates, generates information for us that we're definitely seeing more incidents happening. So also, you're going to have students or staff members, the campus community, who may choose to report online, or they may actually find they're more comfortable in reporting on the app. So the data collection there is definitely going to assist us as well in bringing all of our data together and understanding where the university needs to sort of focus interventions, and the interventions will be with educational programs, interventions that are already in place, but this gets amplified obviously in areas and places that are identified as places that need the intervention. I think with the Cornell app, what's going to also assist the campus community is that we do take complaints that come through from students and staff, as well as external people that report incidents that have happened off campus. And I think the Cornell app is really going to help us in collecting data from those incidents as well, so that we can in fact create awareness, advocacy, as well as the proper educational and other interventions that the campus community needs to be involved in. And we will be doing that going forward with the collaboration with Cornell.
Obviously acknowledging, the proactive steps that the university has taken in engaging issues around GBV. I wonder, and if you can take us into your confidence, how prevalent are such instances either on the campus or obviously off campus, because we also understand that students are part of, larger society, and sometimes their life is lived off campus, but has whatever happens off campus, off site, also has an effect of them whilst they are in the care of the institution.
Yes, and the Office of Inclusivity and Change provides a lot of psychosocial support to the students and staff that experience any sort of sexual violence, whether it's on campus or off campus. And that's been something that we've been very proactive about. I want to mention what you're talking about, off campus as well, is that the Cornell app, as Leonora has indicated, is very user-friendly for those who are reporting cases in the criminal justice system and, helping navigate the criminal justice system itself, which is not always easy. And I find this very useful as well as an additional support to us, because we have students and staff who are survivors and complainants in our disciplinaries who have the option of reporting cases both institutionally, which is dealt with within an administrative disciplinary, but they also have the option of reporting the same case in the criminal courts, through SAPS and going through the criminal justice system. So they can report where both processes run parallel to each other, because remember that the effect of outcomes is completely different. It affects a student status or a staff member status within UCT, whereas the case that's at the criminal court is a criminal offense that's justiciable in a criminal court. So the Cornell app really is very useful for our students and staff as well, because we have an additional support that can help them navigate any processes that they wish to utilize externally to UCT, because we may not always have the capacity to assist them both with the internal as well as the external cases.
Absolutely.
So that's very useful for us as well.
Yeah.
And in terms of I can't give you statistics offhand. And one thing I want to say is that we must debunk this theory that if we're getting more reports of sexual violence, doesn't necessarily mean that there's an increase in it. It could also mean that people are more confident in the systems or the app, for example, and the UCT systems that are in place, both in the reporting and advocacy and support offices as well as the tribunal offices. So the more confidence people have in a system, you will find an increase in reporting. I wouldn't say that there's been any change in terms of the case flow. It's pretty much consistent from last year to this year. What we are very pleased about, though, is that the expediency in which we are taking some of the cases through the disciplinary has been more expedient. There are, of course, always cases that have their own peculiar challenges that end up being delayed for a significant amount of time. But I think this collaboration is definitely going to assist us on several levels. And therefore, UCT is very happy about the collaboration going forward with Kwanele for all of the reasons that we've discussed today.
Lenora, as we close it up, just to double back on 16 days. So you are going live on 16 days with a chat box.
Yep, that is correct. We are just in the process of testing it at the moment, but it is ready to go live.
Yeah. And for those who might, it's not going to be just piloted at UCT, right? It's going live broadly.
Yeah. Yes. So we actually built it like with testing samples nationally. So we worked with nonprofits and community groups all over the country, including the rural Eastern Cape. And our goal is to roll it out similarly. So it'll go through all of our tech, through Facebook, through WhatsApp, so that it's available to the general public. And alongside that, we're going to run a series of digital right workshops in communities and just looking at upskilling people around technology.
Yeah. Ladies, thank you so much for the conversation today. Definitely sounds like an app that is greatly needed in South Africa. And hopefully through this conversation, a lot more people will be reaching out to Kwanele and trying to get their hands on the piece of technology and training those in their communities to utilize it for the betterment of themselves. It's just gone 22 3 o'clock on the Full Circle. Let's take a quick break here and then we'll come back on the other side. This John Gereke is still in for Aldrin Simpier for the rest of the week. He's going to let us know what's coming up on Beyond the Headline.
Borussia Mönchengladbach knows that only a win will make their plan to get to the top half a success. But VfL Wolfsburg's game plan is to grab victory away from home to cement their top half position. This is the Bundesliga.
John is in the building. How are you doing?
I'm fantastic. Thank you for asking.
Which challenge has been accepted?
Any challenge. Bring it on. Where's it there? Is it over there?
I mean, trying to puff up his chest, but you know.
Hold my stomach in more than anything.
What's coming up today?
I'm exhausted. Okay, so I don't know if you know, you must know, in Zimbabwe, Emerson Mnangagwa has tried to stop NGOs from being in Zimbabwe. It's got to do with foreign funding and how they're stopping things from happening. They want to try and do that in Tunisia as well. Now 10 parliamentarians are ready to stop NGOs and they have to report, and they've got to explain where their funding comes from, and it's maybe a way of cracking down on NGOs and allowing laws to come through that are against the law. So we're going to find out what's happening in Tunisia.
And I wonder if are these would this affect NGOs broadly, or would they be specific NGOs? Because they're really big global NGOs,
Yeah, well,
UNAID and hada.
It's all the big ones. All the
Okay.
big ones are part of it. So you remember there's been a mention here and there in South Africa about this as well. They're going to report their funding, and they're funded by terrorist organizations, maybe, which is maybe a good thing. If an NGO is funded by a terrorist organization, then so there's two sides to every coin.
True.
Then I'm sure you've heard 3,300 members of the Defence Force are coming into South Africa, and they will be trying to stop zama-zamas for until April this next year. It's going to cost, I don't understand why, and we'll find out why. It's going to cost 500 million rand for the deployment of the army to stop the zama-zamas.
I wonder why April.
Yeah, I wonder why. And then persons with disabilities will be our big conversation today. We'll talk to a couple of people. We're going to talk to a disability analyst and human rights activist, and then we'll talk to somebody from the Department of Women, Youth and Persons with Disabilities. Has anything changed in the 30 years of democracy for people with disabilities?
I can tell you now that largely the answer is no.
Yeah, still buildings that don't have ramps. There's still I live in a well-off suburb. No sidewalks for people to walk on. Anybody in a wheelchair, you got to go in the middle of the road.
Yeah.
And it's atrocious. But
we
have
build
that
malls
conversation.
still up till today where access is really something that's tekering.
Yeah.
You'll have one random entrance somewhere,
That's right. Or the lift is on the other side of the mall to be able to get up a level.
and it doesn't help during load shedding, right? Because then it's like there's no lift.
So that'll be our big debate just after 5 o'clock.
All right. I'm looking forward to the Zama conversation as well, because remember when the presidents met, our president and president of Lesotho, I think it was table for discussion around how do
Yes.
the two countries come up with some kind of collaborative effort. But I kind of felt a lackluster energy from our neighbors.
I also feel a lot of it should fall on the mines as well. Why aren't they closing down the mines correctly?
That too.
And I think they're kind of under the radar. We're hearing about the criminal elements of the Zama-Zamas and why aren't
Yes.
they being arrested. But if they've got easy access into those tunnels and those mines, then there's a bigger problem. And I think the mines have got away with it a little bit.
Yeah, but then it also speaks to governance, right?
Yes.
Because someone must be overseeing that. If I'm giving you a license to mine and it comes
You
with
need the
certain
rehabilitation.
conditions,
Yeah, you need to rehabilitate it when it's over as part of your budget. You should do
Yes.
that, yeah. But also, I want to know why 500 million. Don't the army guys work Monday to Friday anyway? Why are they getting paid extra? Or I don't understand. Where does the money come from as well?
maybe it's not part of their duties. I don't know.
I don't know either. I'll find out.
John Gerike is coming through between 3 and 6 on Beyond the Headline. He's in for Aldrin St. Pierre for the rest of the week, and you can catch him in Technicolor if you are streaming us on all of our respective social media platforms. Let's take a quick break here rather, and then we come back and we wrap up the show. It is the final moments of the full circle, and we are in conversation with Momina Omaji, who's the Consumer Healthcare Country Head for Scientific Affairs at Sanofi South Africa. And they are a global leader in healthcare, and they are joining us in celebrating National Children's Day, which was last week already, a day that's dedicated to promoting and protecting the rights and well-being of children. And of course, part of the commitment is improving the health of children, of which Sanofi has been running a campaign to raise awareness on the importance of gut health and diarrhea. How are you doing, Momina?
I'm very well, thank you, and good afternoon to you and the viewers as well.
Thank
and
you.
The listeners, sorry, my apologies.
Don't worry, they're viewing on the stream, so viewers works as well today. I think we never talk about these things, right? You never sort of switch on and hear people talking about the importance of gut health.
Definitely not. I just want to caveat that by saying, I mean, on National Children's Day, it's our collective role, as you said at the beginning, as parents, as caregivers, as civil society, as leaders, as government, as industry, to ensure that children are protected, and they're protected from child abuse, deprivation of their rights, and all the way to access to basic rights and water and electricity. And just coming back to gut health, I mean, as you said, not many of us talk about our gut health. We don't really understand what gut health is about, but it's essentially important. It's so imperative because it's responsible for digestion, it's responsible for hormone regulation and immune system. And without the necessary balance, it leads to infections, it leads to dietary issues, and we just need to ensure that we all understand what gut health is and how we can improve it and maintain that balance in gut health as well.
And in fact, before we get into, what gut health is, because I think a lot of us probably don't understand it unless you've somehow suspected that something was wrong and you've done the Googling or the consulting. But what you've just said now that, on the back of National Children's Day last week is also the importance of us understanding, that kids need access to basic rights like water and electricity. And I put forward the argument that this actually, the lack of good, clean water might be a contributing and probably is a contributing factor, right, to whether or not even issues like gut health and diarrhea exist.
Definitely. The lack of access to water and then clean, potable water as well is just one of the many struggles. And then the children living in underserved communities of South Africa are actually 10 times more likely to contract diarrhea and even die from it, just from drinking contaminated water and then contaminated food that has been contaminated with feces and bacterial infections, and all due to, as you said, lack of access to clean water and unhygienic sanitary conditions. The statistics are really astounding and alarming in South Africa, where 1 in 5 deaths in children under the age of 5 are directly related to diarrheal diseases, which can then come back to contaminated water.
Oh, 1 in 5?
1 in 5 deaths is the second leading cause of death in children in South Africa, and if you look further into Africa as well.
Wow. That's a shocking statistic. So in terms of, I guess we know sort of the conversation that needs to be had on a macro level by way of, holding those responsible for providing certain services to task and ensuring that they do. We switch on our TVs, we see the communities, airing their grievances. But on that individual basis, what are some of the things that we need to be looking out for as parents and as caregivers to children, and particularly in that demographic that you just said, 1 in 5, which is children under 5 years old?
When you're looking at some of the symptoms you look at, so for diarrhea, and if I just go back and maybe put it to you rather colloquially, is a passage of 3 or more loose stools per day in the children, and it's usually a symptom of an infection in the gut, as I said, by those many reasons. The risk of death is higher in children and in infants, specifically because they're not fully developed to handle this massive loss of fluid. And the major issue with the diarrhea is the dehydration that sets in.
Mm.
And the symptoms can last for several days, and this is accompanied by nausea, by fatigue, by weakness. You look dry mouth in children, and a lack of tears as well in infants. There's a blood in the stool. There's also a decrease in wet nappies, and this is all due to that fluid loss, which is the water and the salt, which is necessary for survival, as we know. It is then exacerbated as well if there is malnutrition. So you have an exacerbation of the diarrhea due to malnutrition, and the other way around as well, where you would have an exacerbation of the malnutrition due to diarrhea. So those are some of the things that a parent would need to look out for in their children, and to immediately then move over to a healthcare professional or get into contact with a healthcare professional or a doctor or the nearest clinic to get advice and recommendations and treatment as well for their children.
Yeah. And in terms of gut health, I think people are familiar by way of diarrhea, but in terms of gut health, I find that it can be very tricky for a lot of us to understand what are the signs and symptoms that would be cause for worry when one should be thinking, okay, maybe I should seek help and see whether or not I've got a gut health issue.
Yeah, so when we speak about gut health, we speak about the balance between the microbiota in our gut microbiome, right? And so the signs of bad gut health, it could be from bloating, which is relatively minor, all the way to loose stool, as we spoke about, which is diarrhea. You've got the heartburn, the constipation as well. You've got nausea and vomiting. You've got acid reflux, which a lot of people suffer from. And the less obvious are when you look at, there's poor sleep, there's fatigue, there's sort of skin irritations and skin dehydrations as well. There's a lot of food intolerances. There's a lot of signs and symptoms that one can look out for that your microbiome is not in balance. So those are some. When you look at signs of a healthy gut, and again, it comes back to you considering normal passing of stool, 3 times a week, 3 times a day. It's different in everybody, but you've just got to maintain and manage what your passing of stool looks like, because it is different in everybody. So any changes needs to be immediately looked at by a healthcare professional.
Absolutely. Let's talk a bit about the campaign that Sanofi is running. You guys are running a campaign to raise awareness of these issues.
Yeah, for sure. So Sanofi, in partnership with Save the Children, it is a local as well as a global NPO, we are looking, and we launched an ambitious campaign and an ambitious initiative in October last year, where we want to reduce the incidence and the prevalence of diarrhea in the children under the age of 5. And we say that this is a preventable disease. It's a treatable disease. And we want to reduce that 1 in 5 statistic, which is related to 20%. So we've started this campaign, and we started off in Nanda. We all know that there have been a lot of floods recently. There was a cholera outbreak as well. And these increase the chances of these diarrheal diseases. So we launched this campaign in Nanda to reduce it. And what we've done is we've looked at installation of water tanks at early childhood development centers in the Inanda area, and we want to take that into South Africa as well. We want to move that over out of Inanda into KZN, into the other regions and the provinces of South Africa, and increase the awareness of what does diarrhea look like, how to manage it, how to reduce it, but also putting a tangible water tank in place that allows continuous water supply to these ECD centers. And as you're saying, we're talking about children, we're talking about them having access to water, not just at school level, but at the home level as well. So with Save the Children, we've started this initiative, and we've kicked it off, as you said, in October 2022. And we are running this campaign, and it's been running since then I just want to get the statistics up for you, actually. And we have been able to reach over 54,000 people directly, and almost 36 million indirectly as well, through social media campaigns about what is happening in our country, what are the statistics, how can we improve it, and how can we help as well.
Really important work that you guys are doing, and you set yourself an ambitious target to impact 2 million lives by 2025. But I think if anything is to go by, they say proof is in the results. And since 2022, already having change quite a significant number of lives. I think it's definitely going to pay off and might actually even see a higher impact come 2025 than the goal that you've set for yourselves. But Momina, thank you so much for the time this afternoon. We have to leave it there for today. That was Momina Omarji, who's the Consumer Healthcare Country Head of Sanofi. And of course, they, alongside the Save the Children South Africa, have set out on this really great partnership to touch the lives of 2 million children, and by consequence, their families and their communities as well, providing safe drinking, consumable water, particularly in ECDs. And as you heard from Momina already, their efforts really bearing fruits in some of the communities that they've piloted this on. If you want to find out more, you can definitely search their presence on social media and learn a little bit more about that. Even just learn a little bit more about gut health. I think a lot of us are not too clued up in as far as that is concerned, and how do we keep our own guts healthy on a day-to-day basis. On that, it is time for me and my team to make way for John. He's standing in for Aldrin St. Pierre this week. Lots of interesting conversation coming your way today from 3 until 6 on Beyond the Headline. Can't wait to hear that story about the Zamazamas also, with the army coming in, the South African Defence Force coming in to help there. A lot of you have been calling, in fact, for the South African Defence Force to intervene in many things in our fight in Cape Town, in the Western Cape, with the gangs that have taken over some of the communities there, as well, of course, as curbing the scourge of Zamazamas. A lot of people calling for the intervention of the SANDF. But weirdly enough, whenever they are called in to step in and intervene on certain things, somewhere down the line, when they get a little bit heavy-handed, we are also the first people to say that pull them out, pull them out, pull them out. They should not be behaving that way. That's it from us. You can hear Mom Miriam Makeba just leading us out of the show there. It is, of course, today the anniversary of her passing back in 2008. From myself and my team, the conversation does continue on social media, is where you can find us on X, and of course you can find me there as well on X as well as Instagram at Bridget Masinga. Inshallah, God willing, we get to do it again. Dineo Mutaung is standing by with your 3 o'clock news.